Assalamu alaikum to all our listeners and viewers. I welcome you all to another exciting and educating edition of the Health and Fitness Show. I'm Fahad Matin, your host for today, and I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. I do pray that we all had a nice and positive week so far and looking forward for a nice and relaxing weekend. Now, this program is a recorded show from the studios of Inspire FM, and we are definitely casting our positive vibes to all our lovely people in Luton and all the surrounding areas of Luton like Dunstable, Harpeth and Bedford. Our positive airways reaching all our listeners who are listening us from our Inspire FM website, app or radio, or you can view us on our Facebook and YouTube live channels of Inspire FM. As we all know that we cover different health related topics, and some topics are more interesting than others. However, today's topic is slightly different in a sense that we are talking about something which we all get affected one way or another, and that is vitamin deficiencies. Yes, today we are talking about vitamin deficiency, and we definitely like to know what a vitamin deficiency can do to us as a body. Now, as we all knows, as everybody know, I am not the one who will be talking about today's show. I have a very lovely guest with me today, and she is none other than Dr. Sophia Azhar. Assalamu alaikum, Dr.
Assalamu alaikum.
How are you today?
I'm fine, thank you.
As our tradition goes, I really like you to introduce yourself and give us a quick intro about yourself.
I'm Dr. Sophia Azhar. I'm a GP in Luton, and I also do private GP clinic with Optimized Body and Mind, and I'm also doing aesthetics with them as well as my own clinic called Wellness by Dr. Sophia.
And today's show is being sponsored by none other than
Optimized Body and Mind.
Exactly.
Yes.
So, how's your experience over there, Sophia?
It's good. It's good. It's a learning curve. We are getting there, but yeah, it's getting on. Yeah.
Alhamdulillah, alhamdulillah. So, without further ado, let's dive into our topic today. Now, in terms of vitamin deficiency, I know it is very unique in many different ways, shape, or form, because vitamin deficiency is something we all get affected one way or another. So, how do you think a vitamin deficiency affect us?
So it depends. Everybody is different because we have a lot of vitamins that our body needs, and most of them we require for our normal daily functioning.
Mm-hmm.
So every vitamin has its own role. So yeah, it differs. But I think the most common symptoms patients or people can present with is tiredness, fatigue, not feeling energetic, lethargy, stuff like that.
So, if I ask you in a nutshell, what is vitamin deficiency, what you will say?
I would say it is when you don't have the vitamins the body needs to function. That's called deficiency.
Just for our listeners, आज का show हम English Urdu दोनों को mix करके करेंगे. So, people, if you do not understand me in English, I can always jump on to Urdu as well. उर्दू में बता क्या है?
उर्दू में जब आपकी बॉडी में विटामिन्स की कमी हो, विटामिन जैसे कि विटामिन डी, विटामिन ए, विटामिन सी, तो उसको हम कहते हैं डेफिशिएंसी या कमी बॉडी की, क्योंकि बॉडी सही तरह उसमें फिर फंक्शन नहीं कर सकती.
So in terms of, I know in the beginning you mentioned about certain common symptoms and sign of vitamin deficiencies. So when we talk about vitamin deficiency itself, now which signs relate to which vitamin deficiency? Can you explain that?
Normally, it's a generic thing like tiredness, fatigue, lethargy. Agar ho, to we think that this is vitamin deficiency, maybe most likely, and it can be any of them. But if we go by just naming few of them, B12 deficiency can cause symptoms of tingling, numbness, and weakness sometimes in your legs, in your hands. When people come and say that our feet feel too hot, or they say that we feel numbness or tingling in both feet, most of the time it is B12 deficiency or folic acid deficiency.
Wow. Okay. And in terms of, I know, I remember a while back, one of the things which I've been told is that, oh, because I was feeling really really tired. My body aches. I was not able to sleep properly either. I've been asked to drink water, and I was drinking water like fish. In fact, I really want to have a sip of water now. But what do you reckon, a person who's going through these kind of things? Are these the only thing which cause it? As a GP, what do you
No,
reckon?
no, that
If I'm coming to you as a GP, what do you
No,
say?
no, I wouldn't say that's just vitamin deficiency. I would probably want to do a full checkup to make sure you're not diabetic, and other stuff going on. So normally people can, they can just eat healthy and they won't have vitamin deficiency. But but if you are feeling tired, lethargic, or not well, you should of course discuss it with your GP, because you may be suffering from something else other than just deficiencies.
Mm-hmm. So, अगर थकन महसूस हो रही है, that can be cause of other things as
Yeah,
well.
it can be diabetes, it can be blood pressure sometimes. People have headaches, feeling tired. जब सर में बहुत दर्द होता है, या जब आपको लग रहा है से आप सही फंक्शन नहीं कर रहे, आपकी सोच सही नहीं है, या आपको ब्रेन फॉग कहते हैं उसको, तो येस, यू शुड ऑलवेज डिस्कस इट विद योर जीपी, या ब्लड टेस्ट कराएं या ब्लड प्रेशर चेक कराएं. You should take it seriously.
Definitely, and definitely that's a GP's concern, that if something like this happens, please go and seek a clinical advice from your GP.
Yes.
So in terms of vitamin itself, I know whenever we ask GP, can we take vitamins, they always concerned about it. Now, what are the concerns which they normally have?
Because it depends on which vitamin you're going to take, especially. If you're going to take vitamin A, that shouldn't be taken in more quantity, because it can cause hypervitaminosis. That means, especially if you're pregnant or a child, it can cause problems with your eyes, your heart, your kidneys. So it needs to be taken in a specific amount. So that's why you should just not go and get something from over the counter, especially vitamins, just like that, and start taking them. You should always follow the instructions. If you are buying them from a pharmacy or something, there are always instructions on it how to take it. The same goes for thiamine, niacin, riboflavin. These all vitamins, they are very little vitamins that you need minute quantities to function your body, and you can easily get them by a good balanced diet, because almost whatever we eat every day has these vitamins in them.
Mm-hmm. So in terms of when we talk about safety concerns and the correct dose, so how do you know what are the safe and correct dose of vitamin to take?
They are on the NHS website. If you search for vitamins NHS, you can see the correct doses on it. They're very nicely listed. Also, when you go to a pharmacy and buy them over the counter, they will have, when you see the instructions from the back, it says clearly how much to take. And it will tell you clearly, do not take more than 1 tablet, or do not take more than 2 tablets in a day, because it can cause other stuff. So I think you should always follow the instructions that are on the package. Again, some vitamins you can take as much as you want to, and they will just come out in your way. So it really doesn't. You can't actually store. Some vitamins cannot be stored, so they are just expensive urine then.
Exactly. अच्छा, जहाँ तक multivitamin का ताल्लुक है, now one of the things which majority of the doctors says, instead of taking multivitamins, have fruits and vegetables, and take your multivitamins from fruits. क्या उसकी कोई concerns है क्या? Do multivitamins have any safety concerns जो उसकी वजह से doctors कहते हैं?
No, not really. I think it's just to encourage people to eat healthy. Sometimes some people are on the go all the time and they can't eat healthy. People who are traveling, people who are probably, running around, probably clinicians themselves, in hospital. I mean, we hardly get time to eat properly. So I think sometimes it's okay to take them, because at least you're giving your body that nutrition that is required, because you're not eating what you should be eating. They're not harmful if you just take what is said on the instruction leaflet. But अगर आप ज़्यादा ओवरडोज करने की कोशिश करो कि आज मैं ये सारा विटामिन डी खा लूँगी तो मेरी बॉडी बिल्कुल ठीक हो जाएगी, तो ऐसे नहीं होता. इट्स योर बॉडी कैन ओनली एब्जॉर्ब some of it in one time. So this is why you have to take a specific dose every day. If you put too much in it, either it will cause a hyper problem or it will just come out in UV. So there's no point.
All right. Okay. So, but in terms in a correct dose or a safety dose, multivitamins, how do you reckon we should take, or do you still say have balanced diet?
I would say take them. I mean, they're not harmful. Take them properly. Don't take them, like I said, overdose or don't overdose on them. But eat healthier. Yes, you need to eat healthy.
अच्छा, placebo effect तो नहीं होता उनका?
Placebo effect depend करता है, I guess, because some people say हमें तो कुछ फर्क नहीं पड़ा, and some people we feel so much better. So
yeah, that's what I was asking.
Yeah, so
there are
it
two
depends.
school of thoughts.
Yeah, but like vitamin D, for example, some people who have really low vitamin D, once their vitamin D comes at a sufficient level, then they will feel a difference. The myalgias, the aches and pains, the joint problems, it will get better. So it depends again on the patient if they did actually have a deficiency. Of course, somebody who's healthy, who has everything in range, वो खाएंगे तो उनको तो कोई फर्क नहीं पड़ेगा. Probably they have something. This is why I'm saying maybe they have something else going on, so they need to go and investigate that. But some people, like if they have vitamin D deficiency or vitamin B12 deficiency, the minute the body comes to that level, they will see a difference. So again, I don't think it's a placebo effect if you really need it.
अच्छा, आजकल एक कॉमन प्रॉब्लम है और मेंस में बहुत ज़्यादा होती है हेयर लॉस की.
Yeah.
मेरे पे भी आ रही है unfortunately. So in terms of which vitamin deficiency cause hair loss or prematureness of grayness, as you can see?
So that question is I'm sure on everybody's mind, but it's aging.
Come on, not everybody's mind. You have a nice set of black hairs. Come on.
Yeah.
Mashallah.
It is, you can say it is how the body ages. But yes, what you can do is, or what you can help yourself with, is by taking biotin injections or biotin supplements. They do help. Again, eating healthy, making sure that your diet is good. Folic acid, that also helps maintain the hair growth, hair strength. And then there are other treatments that you can do that are like aesthetic based, PRP and stuff like that. But I mean, it's going to happen with age. You're going to have hair loss, you're going to have gray hairs, but it's not because of a specific vitamin deficiency. Sometimes because of iron deficiency or folic acid deficiency in young people, they can have hair loss and brittle hair. Yes, that then you do a blood test, you can see it, and then you can also thyroid deficiency can also cause that problem. So then, yeah, if you have a thyroid problem, so this is why you need blood tests. So if you're having that issue, you should probably see the GP or get a private blood test. So then you know what is it that you're deficient in. So
luckily, you being sitting on both sides, you see things from both sides.
Yes.
So when I come to you as a GP, कि मैं अपने GP के पास आ रहा हूँ, I'm coming as a patient to my GP, and I ask you to get a blood test done, and I'm coming to you as a private patient and coming to you and says, can I have a blood test done? What's the difference between those two blood tests? And where can I have the blood test then?
So the blood tests are done with the Optimized Body and Mind on the site. And they also send out kits. So you can always buy them online.
Kits, can I draw my own blood?
No, it's not like that. It's a different type of kit. I think it's prick. You prick and...
point of care test.
Yeah, okay. Yeah, something like that. I mean, if you go to your GP, of course, we are, as NHS GP, we are limited on the blood test we can offer to the population. But as a private GP, the blood test would include your hormone levels. It would have your thyroid function, vitamin D levels, folic acid, B12 levels. We do a full health check with lots of blood tests that can help us identify if you are deficient of something or if you are suffering with any medical problem. So I think it's a good way of first doing a full checkup and then realizing what's wrong in the body, and then trying to treat that.
Oh, okay. So, you said that in the GP land we are limited to test. Is it because if you as a GP think, okay, these tests are not important, you guys don't go for it? Is that correct?
Yes, if you think it's not needed, then we won't do them. Yeah.
Whereas with optimized full
you get a full NHS check. Not an NHS check, sorry, full MOT, you can say.
Blood check.
Yeah,
okay.
blood check.
And what does those blood tests contain? Means what markers they give you?
So, like I said, full blood count. It'll give you all the B12, folic acid, vitamin D levels, because normally we cannot do them in NHS. The vitamin D level is only done if the lab thinks that, yes, there will be a deficiency. And what else? Hormone levels, FSH, LH, testosterone in men, thyroid function test, diabetes levels. We check, everything is checked in one go.
And is that a fasting blood test, or is it?
It's not normally fasting, no.
By the way, what's the difference between fasting and non-fasting?
It's just to check your fasting glucose levels and your lipid fasting, that's all.
Okay, but then it does not give you any vitamin deficiencies?
No, not the fasting, no.
Okay, yeah. Okay, let's come back to the hair loss again. Now, so as you mentioned that the hair loss normally happens with the aging as well. So, which age level you think that people are starting to lose hairs or starting to have grey hairs?
So above the age of 30, of course, you're going to start aging. 35, more aging, and then when you reach 40, the level speeds up, kind of. So some people are lucky, they have good genes. Again, it all depends on your genes, your eating, your sunlight, the UV rays, yeah. So how much you get. Also, how much you dye your hair, how much heat you're using on your hair. All these things, people don't think of it because it's not a medical thing, but it's a cosmetic thing. If you are going to bleach your hair and dye your hair and blow dry it every day, it's eventually going to break, become brittle, become dry. So that will also lead to damage to the follicles. That will lead to hair loss. So again, it depends how well you look after yourself.
And I'm going slightly off topic, and I know it's nothing to do with vitamins, but can a person get their hair grown back up, especially the ones who are losing hairs?
So it depends. If you have a hair transplant, then yes, basically, if there's no rejection. And with PRP, that's another treatment that we use in aesthetics. It's called plasma that we take from your own blood, and we inject it back into your scalp. So if you still have hair follicles there, then yes, the hair can grow back, and the hair may be thicker and more strong. It also helps the other hair around you to become thicker and strong. So that's what PRP does, basically. But if you don't have any hair follicles in that area, then it's very hard for you to grow hair back, yeah.
Okay. So you said, what are the best supplement to take for hair loss?
I would say biotin, folic acid.
So biotin can be taken as an injection as well as...
We do injections in Optimize, and it can also be taken as tablet form.
In terms of... you mentioned about B12 earlier as well. So is it common to need B12 injections?
I mean, yes. In Luton, I have noticed that lots of people are low in folic acid and B12. So, yes, it is quite common to get B12 injections here.
So, what is person deficient of which requires a B12 injection?
Oh, B12 is a vitamin, like every other vitamin, and normally they are deficient of. It's like they don't eat fish, meat, dairy products, wheat. Sometimes in these things, they don't eat properly, and then the body becomes deficient of it. And there's another way that it's also deficient. That's called pernicious anemia, where the body doesn't absorb properly. So if somebody is suffering with B12 deficiency, persistently, and we give them injection and they come back and it's again B12 deficient, then we give them injection, they come back, it's still the same after 6 months, that means the body is not absorbing it and there's something going on with the tummy. So we do a test that diagnoses them with pernicious anemia. So those people need to have a B12 injection after every 3 to 6 months.
Oh.
It's a lifelong thing.
Oh. So is that available on NHS or is it?
Yeah, that's of course that's a medical problem.
Okay.
That's because your body is not letting you absorb it. So that's something you can't treat otherwise.
Control, okay.
Yeah, you can't control. Yeah.
And is there no cure for that?
No, because it's what we say autoimmune problem. Body itself is just doing it.
Mm-hmm. Okay, I did not know. That's a really good information. So in terms of because one of the common things which I heard, people need B12 injection, and I said, okay, why do people need? So yeah, that's one of the reasons.
Yes, if they have a medical problem, yes, they need it.
Mm-hmm.
But sometimes people need it because they're just not eating properly.
Right, okay. Now, coming back to, you mentioned about vitamin D deficiencies. Why are we, as people from subcontinent, are very deficient in vitamin D? And this is something which I heard from pretty much any and every single GP I remember. Some GPs are really vocal about it, that we should take vitamin tablets.
It's because of our skin color. We don't absorb the sunlight as well as the other skin color people.
Mm-hmm.
And also because of our, you can say because of our religion, we cover ourselves from head to toe, especially women. So they have less body exposure to absorb the sunlight. It is advised that everybody who is in UK should be taking vitamin D every day, especially in the winter period when the sun is not there. But I normally advise everybody just to take it once a day, every day. It's just one small tablet, 1,000 units. That's for adults. And for children, it's about 200 to 400 units. But again, you should always check the dose before you give it to children. But yes, everybody is deficient of vitamin D apparently, as far as I know.
So when we talk about vitamin D itself, does vitamin D have classes? Because I heard about vitamin D2, D3.
That's not for, that's just something for medical purposes because the body converts it into the other vitamin, that's all.
So what's the difference between these two?
It's just how the body converts it. It's just it's inside the body, so it doesn't really matter. Mm-hmm. We take the form that our body can absorb. Body makes the form that the body can absorb. So if you're taking from diet,
mm-hmm.
it needs to be converted into the vitamin D that needs to be absorbed by the body. But the one that we take from over the counter or outsourced, that is just absorbable. That doesn't need any changing.
All right. Okay.
Yeah.
So in terms of vitamin D itself, I know you said vitamin D tablets need to be taken in. So is there vitamin injections for vitamin D as well?
Yes, there are injections that optimize body, mind and health gives. Yeah, there are injections as well.
So what's the difference between injections and tablets itself?
It's a high dose injection. It's like it's giving you a loading. So you load it with the vitamin D because you're deficient, and then you have to maintain it by taking it. Let's say again, after 6 to 10 weeks, you start taking one tablet every day.
Oh, so one tablet after 6 weeks.
So once you've had the injection, depends again how what injection you're having, but normally that's a loading dose. So we've loaded the body with it. Mm-hmm. But like I said, we can't store it. So the body's not going to store it somewhere. It's just going to get used. So to maintain the storage or to maintain the
correct level in your body.
Yes, so you need to take one tablet every day, or sometimes people take like bigger dose, like 5,000 units after once a week. So it depends how people want to take it. But again, you should talk to your GP or to a clinician before you decide how you want to take it if you're not too sure.
Okay. Yeah, because sometimes we just literally take it and then
you forget about it.
Yeah, exactly.
Yeah.
Because even with the tablets every single day, it's a pain that you have to.
Yeah, I know. People forget. People think that just they've had a loading dose, now they're going to be fine for the rest of their life. No, that's not it.
That's what I thought with the B12 is.
No.
B12, yes. I have that.
Body has to use it. It's going to finish again, isn't it?
So So how often do we need to take these injections?
So, like I said, the B12, you need to have a blood test to know if you need to take it or not. Vitamin D, I think everyone should take it. One tablet a day, 1,000 units. Or, like I said, you can talk to your clinician or a pharmacist. They can tell you how to take it. Or you can come to Optimize Body and Mind. I can tell you how to take it. But yes, so that's. I mean, it's I can't give just a generic advice. Everybody is different.
But in order to do that, go and have a word with your GP.
Yeah.
Or come for a private consultation at Optimize. So, by the way, how much injection cost over there?
I'm really not sure about the prices because I don't deal with the prices, but
there's a discount available for everyone, isn't it?
it depends.
Come on.
If you use Fahad's name, yes, you can have a discount.
You will use Inspire's name.
Yeah, Inspire's name.
Exactly. Come and say you have heard about
the injections.
Injections at Inspire FM, and you will get.
Before we do any injections, we do blood tests. So yes, that is a requirement.
Good. Yeah, because sometimes we do not know how much deficient we are. And
yes.
To be honest, when I got my blood test done, I was completely surprised the amount of deficiencies. So with the vitamin D deficiency, what does a vitamin D deficiency do? If a person have vitamin D deficiency, what does it trigger?
Like I said in the beginning, you can have muscle pain, aches, fatigue, tiredness, joint aches and pains. Your bones can feel brittle. You can end up having fractures. There's another thing people are not aware of is that young children who have recurrent chest infections or who have asthma get recurrent asthma attacks. It normally happens if they have vitamin D deficiency. So you need to. This is why vitamin D is very important in children, so that you can prevent them from getting so unwell. So if your child is getting these infections, you should talk to your GP again and get a blood test done.
Indeed. And on that note, let's take a quick short break. So when we come back from the break, we will talk a bit more about the vitamin deficiency, and we will ask the safety ways of taking injections, and definitely how much it costs, and definitely what are the other severe symptoms of vitamin deficiency. Stay tuned with us, and we will be back after these very short messages. Assalamu alaikum and good evening to all listeners and viewers. Welcome back to the Health and Fitness Show. I'm Fahad Matin, your host for today's evening, and we are talking about vitamin deficiencies. Yes, you have heard me correctly. We are talking about vitamin deficiencies with our very own Dr. Sophia Azhar. I completely forgot the name. I was about to say something else, but this is a recorded program, and we are recording it from the studios of Inspire FM for our lovely people in Luton and all the surrounding areas of Luton, like Dunstable, Harpeth and Bedford. Our positive airways reaching to all our listeners and who are listening us through Inspire FM radio app or website, or viewers who are seeing us through Inspire FM Facebook and YouTube links. Channels. So good evening and welcome back. Before we went on break, we were talking about vitamin deficiency, especially about vitamin D deficiencies and how much problems it can cause us. Like जैसे Dr. Sophia ने बताया था कि vitamin D deficiency cause different things like
जैसे कि आपकी बॉडी में जो दर्द होती है माइल्ड उसे कहते हैं मसल पेन. कुछ लोग कहते हैं गुट्ठों की पेन समथिंग लाइक दिस. और आपकी जॉइंट्स में पेन जो होती है, जो आपके अगर बार रिकरेंट इन्फेक्शंस होते हैं, चेस्ट इन्फेक्शंस बच्चों में हो सकते हैं, उसकी वजह से थकावट होती है बहुत ज़्यादा. स्लगिश फील करते हैं, स्लो फील करते हैं, ब्रेन में थोड़ा लगता है सही काम नहीं कर रहा. ये सब कुछ विटामिन डी डेफिशिएंसी की वजह से हो सकता है.
Indeed. और अगर आपको इस तरह से कुछ भी हो रहा है, so you can always definitely consult with your GP, okay? और अगर आपको private consultation चाहिए तो you can go to
Optimize Body Mind.
Exactly. And it clearly states that this show is being Sponsored by Optimized Body and Mind. Thank you so much, Sophia. So, इसके अलावा जो अब, and to be honest, instead of me welcoming you, I just literally go on to the questions directly.
Okay.
So, Sophia, in terms of vitamin deficiencies, आपने कहा था कि injections भी हम ले सकते हैं. That's called loading injections.
Vitamin D ka, yes. But there are other IV drips. So आजकल they are very in because of the way you can just get an IV drip and your body is replenished with all the vitamins that you need. Yes, कभी वो helpful हो सकता है, पर कभी just like I said पहले भी कि expensive urine भी हो सकता है, तो इसलिए blood test करना बहुत ज़रूरी होता है. Before getting any injection, I would always recommend अपना पूरा blood test कराएं, अपना checkup कराएं, डॉक्टर से बात करें, फिर किसी ऐसी चीज़ के लिए जाएं.
Definitely, and optimize of a complete blood test as well.
Yes, we complete consultation with a blood test and फिर as you whatever you need उसके मुताबिक.
So, how long a blood test normally takes to get all the necessary information?
I think the blood test comes in 2 days. Yeah.
So, have a blood test first, have a consultation and a blood test.
Yes.
And definitely wherever you are deficient, please do come and say that, yes, I'm deficient of this one.
Yes.
Please give me something
Injections.
for that. So, in terms of IV drips, injections, how much it costs? You said it varies, isn't it?
It does vary, yes. Like I said, I don't know the prices because the other part does deal with the costs. But they can be a bit expensive, yes. थोड़े से expensive होते हैं. पर अगर आप इंस्पायर के थ्रू आएंगे तो आपको डिस्काउंट मिलेगा.
Definitely. In terms of when we talk about the regular injections as well, so is it a different injection for kids as well as adults in terms of?
We do not inject kids, no.
Right. Okay. So the injections are just for adults.
Adults, yeah. It's not for kids.
In terms of vitamin deficiencies, I know vitamin deficiencies varies between adults and kids as well, and sometimes kids also have vitamin deficiencies,
Yes.
and they have their own problems as well. So, what kind of a problems? Because sometimes kids normally come and say, "Oh, I'm having pain," or they end up waking up in the middle of the night. You have kids, I have kids. They're waking up, end up in the middle of the night saying, "Oh, my legs are hurting, my sections are hurting, my hands are hurting." Is it because of vitamin deficiency, or it could be something else as well?
It can be because of vitamin deficiency, like vitamin D, iron deficiency, folic acid deficiency, B12 deficiency, but it can also be something else. So if a child is waking up at night saying their legs are hurting or their head is hurting, or that's not normal. Children don't normally wake up saying my body is hurting. If once they've gone to bed, they don't wake up. So I would take that seriously and discuss it with the GP so that the weight, height can be measured. Also, we can do a blood test to see if there's any deficiency.
Okay. Now, being a GP now, I'm bringing you back to the GP land. If a patient comes to you with these things, will you prescribe them vitamin?
Just like that, no.
Why not?
Because I would like to make sure there's nothing else going on. I don't want to mask the problem. It's better for me to find out what the actual problem is.
Okay. So, in terms of once it's been proven that yes, person is vitamin deficient in certain ways, but it's not major, it's minor, negligible. What advices you will give? So
over the counter, you can get folic acid, you can get B12, you can get vitamin D. So I would advise them to get it over the counter. If it's a child, then yes, we can prescribe. But if it's an adult, they can just buy it over the counter.
So in terms of child, what kind of prescriptions normally go for?
Depends if it's iron deficiency or if it's vitamin D deficiency or folic acid deficiency.
Okay. So what's the difference? What are the symptoms for all of them?
Again, all the symptoms kind of, you can say they get all mixed up. So I wouldn't be able to say that, oh, this is only B12 deficiency. But yes, like I said in the beginning, adults normally have hot feet and they say that रात को सोते हुए burning हो रही थी palm के अंदर, or मुझे numbness होती है, tingling होती है, जैसे चूंटियाँ चल रही हैं, तो that is most likely to be a B12 deficiency. But the rest of them are so mixed up. You can't actually say, okay, I will do this blood test, so I will know this is just folic acid deficiency. You can't. It's hard to do it that way. This is why we do the whole check, which includes iron, B12, and folic acid.
So I know folic acids and iron deficiencies are normally quite common in pregnant women.
Yes, can be.
So what is the main reason for that? Is it because their diet or?
No, because I think it's because their body is trying to give all the nourishment they have to the child they're growing inside them. So because of that, the child is taking all the nourishment, but the mom is left with less. So if she's not giving her body that extra nutrition, then that can cause her to be deficient. So the child will be fine unless it's really like a folic acid is really, really low. Then that can be a problem, or iron is really low. That can be a problem, because eventually once the baby has taken everything from mom, and the mom has nothing left to give to the child, then they will start having defects because they need that nourishment to grow. So that's why most pregnant women are deficient of these things. It's a very basic advice that anybody who's trying to get pregnant, from the time they're trying to get pregnant, they should be taking folic acid. And it's just a normal dose, 400 micrograms they can get over the counter, 1 tablet every day. And same for vitamin D. They should be taking 1,000 units once a day from the time they've decided that they're going to get pregnant. So it's preconception, and you can stop the folic acid after the first trimester, but the vitamin D needs to be continued till the end of the pregnancy, and probably when they breastfeed and everything.
Okay. So in terms of those females, do they get injections of?
No, we do not inject pregnant people.
Pregnant women.
No, pregnant women, yes, we do not inject them.
So now we mentioned about vitamin D deficiency, and we mentioned about vitamin B12 deficiencies. Now, what are the symptoms for severe deficiencies for these people? Do they have like a very high symptoms, or sometimes they mask with something like big diseases as well?
So, for example, people who drink alcohol, and when they drink too much alcohol, the body stops absorbing the vitamins. So this is why they need to be put on a high dose of vitamin Bs. So same thing can happen. What can happen is you can notice that you're not walking properly, your legs are not functioning properly. There's so much weakness in the legs. Like I said, your memory is going. You feel like you can't remember things, brain fog. Some people even have brain damage.
Yes,
So you don't drink alcohol, do you, Fahad? So these are things that can happen because of these deficiencies. Yes, they're severe cases. Then they need to be on high dose. Sometimes even be monitored in the hospital. So it hardly happens to people who don't drink. So. But it can happen to malnutrition people in third world countries where people are not fed properly, who don't have proper food, people who are starving. Yes, it can happen to those people.
And all these symptoms are varies on different people.
Yes.
Now, these symptoms which Dr. Sophia just explaining is a general case, and as I said, as Dr. Sophia said, that they are specifically for people who are heavy drinkers.
Or really malnourished.
However, people who might be facing, like I sometimes have brain fog, and sometimes I feel like, I lost the track of time, or I'm losing my mind in halfway shape or form. These things may not be related directly to it. Please go and see your GP if you have any concerns regarding anything.
Yes, please.
Yes. We have a GP on house. So if you guys have any questions or queries, you can send your questions and queries into our Facebook chat comments or YouTube comments as well. We will come back. Dr. Sophia can answer it as well.
I can answer on Facebook, yes.
Yes. Now, in terms of, you mentioned about absorption of vitamins in our body. How can we make sure the vitamins and minerals and irons being absorbed in our body? Firstly, how can we take them naturally? What are the best things to do? And how can we make sure that those things are absorbed in our body?
So, how to take them is the best way is, of course, a balanced diet. So you should always have some fruit, some wheat, milk, dairy products. What else? Green vegetables. They have lots of good vitamins in them. Again, for vitamin D, some you can't take enough. So, and calcium you can't take enough because you wouldn't be able to eat that much dairy in a day. So that's why I would advise you to take it as a supplement. But the rest of them, you can take them if you're eating meat, fish, wheat, broccoli, Brussels, all the good leafy spinach, oily fish. So all these things do have the right vitamins in them. How to absorb them would be by just eating the appropriate amount, I guess. Like I said before, if you take too much, it's just going to come out in your wee, or it can sometimes cause damage if you take too much of it maybe in a supplement form. But in a food form, it is normally only that amount will be absorbed, that amount is required. The rest will just be weed out.
Mm-hmm. So when you said taking too much or taking extra amount of supplements, what do you mean by extra amount? So how do we know that we are taking the right amount and not too much? And what are the side effects of those extra?
Follow the instructions that are on the box that you take. They would always have the right instruction. For example, vitamin A, do not eat too much liver because that's not good for you. Vitamin A is very rich in liver. So if you eat too much liver, every day you're eating liver because I want lots of vitamin A, that can cause you hypervitaminosis, and that can cause damage to your eyes, to your brain, and to your kidneys and your heart. So you don't want that because it'll go and start accumulating around the organs and will alter the function. So that's what I mean by not taking too much. Vitamin D, again, if you take too much, can cause you to have either high calcium or low calcium, which again will cause a problem because your bones can become brittle. So we don't want that to happen either. So you need to take the required amount. This is why a blood test is important, to make sure. Otherwise, just take 1,000 units every day. That wouldn't be too much for your body. Again, folic acid also, there's no point taking too much because it's going to come out in your wee. I don't know about any harmful effects of taking too much folic acid, so I won't be able to advise on that. Vitamin C is an antioxidant. It's okay to take that, but again, you can take vitamin C so much easily by just eating fruit, oranges, so you don't have to actually take supplements on that. What else? I think we've covered all the vitamins.
What about calcium and potassium and magnesium?
You don't need to worry about those. Those are very specialist vitamins that probably only people who really do not eat properly. Like, elderly people who are not eating because of low appetite or because they can't swallow properly, or they need to be on specific diets to get that potassium, magnesium and phosphorus in the body. You don't need to worry about that.
So people don't, like, when you mentioned about diets, and there are people who want to lose weight, they normally go on a crash diet. They end up taking X, Y and Z things, and they go on fasting, means they literally do not eat anything, or they give up carbs and so forth. Do that affect the balance of these things in their body?
Yes, that's it's starving yourself will cause you to use all the vitamins that you have in your body. That will then make you deficient, and then you won't have that, and your body will stop functioning properly, and you start feeling tired, fatigued, not able to do what you want to do properly. So that crash diet is never good for your health. It's not recommended.
Obviously, not everybody is blessed like my sisters. Health-wise, somebody are like me.
I do work out and I do eat healthy, so yes, it's not all natural.
In terms of healthy diet, and now people do sometimes think that they're taking healthy diets, but they cannot. They're thinking that they are having 3 times a meal, having nice balanced diet, but their still body doesn't absorb the things. So is it because they're not taking it the right amount, or do they have some serious health conditions?
They may have some serious health conditions, so they may need to, again, like I said, speak to the GP about it. But normally, if you're having the proper food, I think I shared this last year, 2 years ago, the food plate from the NHS website that shows what should be on your plate, so that you have everything. So if you are eating that all the good stuff, but you are still feeling, like I said, tired, fatigued, you think you have some vitamin deficiency, or you feel like you're, there's some issue, then blood test and seeing a GP is I would recommend the first thing, rather than putting more vitamins in your body. I don't think that would actually
help anybody.
No,
Exactly.
It just masks things basically.
So when we talk about people like who have diabetes or respiratory conditions or autoimmune diseases and so forth, so having these injections, will they help them, or by taking these supplements help them, or sometimes become a counteractive?
So for B12, if you have autoimmune problem, you can only take injections, because, like I said, the body can't absorb it. So there's no point taking tablets. The rest, it may help giving you back what you don't have, but then how are you going to maintain it? That's important. So yes, how many injections are you going to have for the same vitamin problem when you can actually take it by yourself? This all depends, I guess, on one person to other person, how they manage their symptoms.
Now, in terms of dietitians, do they able to help you regulate the vitamins, or what sort of vitamin requirements your body?
Yes, for people who actually need them.
Yeah.
Unwell people, like I said, elderly people who are not eating properly, malnourished people. Sometimes people, now that we have lots of people from, refugees, asylum seekers, they don't get proper diet. These people, they do need dietitian referrals, yes.
So, do Optimize offer a dietitian referrals as well?
I don't think we offer dietitian referrals, no.
Okay. But as a GP, you normally offer?
We will if you need it, yes.
Okay, so is it a self-referral, or do you guys normally refer?
So you have, like I said, you come to us, we do a blood test, we find out what is the cause, and then if we need to, yes, we will.
And in terms of as I mentioned earlier, about how can we find about that we have the right amount of calcium, iron, potassium, magnesium in our body, we can get a private blood test.
You can, yes, you can.
And you said that so what's the difference between the finger prick test, which you said people can have that one, or they can come to Optimize and get a full blood test?
So I'm not 100% sure, but I think the finger prick test also checks for almost everything. But I'm not 100% sure. The blood test that we do in the Optimize is a proper blood test you have at the GP surgery, but with everything in it. So we check for calcium, zinc, magnesium, all these things. And then, of course, we treat it. We also do test for if you have irritable bowel syndrome or any allergies. We do have those tests as well, which checks what kind of food or what kind of products you may be allergic to that may be causing you to have those symptoms. So that's also one good test that we offer there.
Okay, and is there a different treatment for that?
So again, treatment would be that you will know that what are you allergic to or intolerant to, so then you can avoid those things.
So it's not like we have to start coming and drop one thing for a week and then that decides.
No, it's not like that. It's a full check of the body weight. It tells you that you are allergic to this or intolerant this, and this may be, and your gut cannot absorb this properly, or it's causing the issue of your IBS. So then when you start avoiding it, you will start seeing difference, and that would make you feel healthier and happier, I guess.
Going back to the skin problems, now people do have eczemas, people do have sensitive skins, pigmented skins and so forth. So what is it, just vitamin D is the only solution for it, or is it different things?
So we do at Optimize, we inject something called as vitamin C and a glutathione drip. It's for pigmentation and brightening of the skin. That's one of the drips that is offered. But again, I wouldn't do that without having a proper consultation and a blood test first.
So for any, basically for any vitamin intake, the best thing to do is to go and get a proper blood test.
Consultation, blood test, yes.
Proper consultation and a blood test from a GP or privately from Optimize, and then make necessary plan with the help of a consultant, consultation with the GP.
Yes, so it will be just won't be one off. I'm going to give you one treatment and that's all. Bye bye. That's not how it works. We have to have specific treatments. There's a plan and follow up and make sure that it's working for you.
Indeed. And on that note, I must say, wow, the time has passed really quickly. We just have few minutes in our hand, so I will ask Dr. Sophia to give a quick recap and a positive message for us.
Okay. Be healthy, look after yourself, always get advice before you try to try something new for your body. For example, don't take too much, don't try to take too many vitamins just because you think it's going to help you. First, talk to somebody about it. What else I can advise? I always advise workout, exercise, eat healthy, be happy. You will get there.
and definitely when we are working towards our own goals and our own health, it helps. And if we do a proper workout, it helps us to absorb all those nutritions in our body, and definitely it helps a lot. Okay.
Yeah, it helps your mental health as well.
Yes, exactly. Yeah. Exactly. Well, thank you so much, Dr. Sophia, for
thank you
coming
for having
today.
me. Yeah.
And thank you so much for sharing such a lovely knowledge and expertise with us, because these things sometimes it's really hard and not easy to remember. And as we are approaching towards Ramadan, what do you reckon? What's the best course of advice you will give to the people, especially people who are a bit kind of a health conscious? I know you love healthy diet.
I would say avoid fried food, please.
So that means we are coming to iftar at your place then.
Yeah.
So what's your advice on that?
So again, for Ramadan, it's time to worship Allah, and it's also about your own inner self, how you going to, it's kind of a detox, you can say. So I would say have a good healthy breakfast and have a good healthy iftar. Avoid fried food, avoid too many takeovers, oily food. Try to have simple meals, healthier meals, fruits, stuff like that. But don't overeat, of course. That's another important.
And always remember us in your duas.
Yes, always remember in duas.
Exactly. On that note, I must say thank you so much, Sophia, for coming in today.
Thank you for having me.
And thank you so much for all our listeners and viewers who have seen us today. We will be back again next week with another broadcast, and definitely we will be then starting Ramadan broadcasts as well. So stay tuned with us. Keep us remembering us in your duas. Until next time, I'm your host saying Assalamu alaikum.